I want to talk about how you can tell if an ECG is artifact versus a rhythm that you should be concerned about. I would venture to say that 99.9% of the time it's usually artifact. However, we always want to double check and make sure. And so I'm going to show you some different examples of artifact, talk about some different things that cause them, as well as some things that you can look out for to ensure that it is in fact artifact and not a concerning rhythm. Let's start off with this one. So you can see here, you can see the QRS spike, QRS spike, QRS spike, and then like a crazy amount of spikes in between. This is definitely artifact, and this is probably caused by some sort of like interference. Like a patient might be scratching, brushing their teeth, maybe they're doing CPT, someone's patting someone on the back. Any repetitive motion, or if you take your ECG leads and do this, you'll get that. This is also artifact. You can see your QRS spikes, and you can still see your P wave and your T wave, but you see this really thick line here. This most likely needs like a lead change or a wire change, or sometimes there's some sort of static interference. This is also artifact. You can see that our ECG kind of goes up, back down, and then comes back up again. Most likely this is the patient's respiratory rate interfering with the ECG, and it's a motion artifact because this is probably the patient taking a breath in and out and in and out. Also artifact, this is just something random. You can see your ECG here and then just probably someone jiggling something around. Okay, but how do we tell if it's artifact versus something concerning? If your patient is on a monitor, compare all of their different waveforms. So if you see this ECG here, let's pretend there's a little squiggly in there with artifact, and you see your pulse ox here is nice and plethy. If your ECG QRS spikes are not coordinating with your pulse ox pleths, then most likely you have some sort of artifact. Also, a good rule of thumb, if you're ever concerned about a rhythm, check a blood pressure because it's going to tell you if you got a perfusing rhythm or not. Another thing you can do is compare the prior ECG for your patient to what you're currently seeing to see, is this happening or is this just a random little sploof? And look at your patient. Are they doing anything to cause this artifact? When in doubt, change out all the little ECG stickers. You can also change out the cord, get a new monitor if possible, and just troubleshoot from there. Sometimes if you have machines close by or noise, that can also interfere with your ECG causing artifact. I hope this helps. Let me know if you have any questions.